Imagine you are waking up every day feeling like you are sinking into a quicksand with no way out. You try to move, to care, to connect, but everything feels heavy. It's like you are looking alive through a fog. This is the reality of for millions living of depression. So today we are not just going to talk about the symptom, but also the hidden struggle, and the most importantly, the hope for recovery. Assalamualaikum and very good evening to all of you. My name is Mama Afi, and today I would like to share with you guys about important topic which is depression. But before we go to depression, we have to know what is depression. So depression is some kind of mental illness. Next, this is my content outline. So today I will share with you guys about what is mental illness, depression, causes of depression, impact of depression, and ways to recover. Next. So before I give you guys the definition of the mental illness, I would like any volunteer that can come up with your own word about definition of mental illness. Anyone want to give a try?
Okay, it's something related to something that you cannot see
Oh,
physically, maybe.
okay, thank you for Miss. Um, next. Okay, according to the Isaac Ray, Act in 1953, a mental disorder, or referred as a mental illness, a mental health condition, or a psychiatric disability, is a behavioral, um, behavioral or mental pattern that causes significant distress or impairment of personal functioning. Next. Okay, we're moving on to the depression. Depression is a complex mental health condition that affects how you feel, think, and act. It goes beyond just feeling sad or having a bad day. For the example, experiences that normally bring person a pleasure and joy, but not anymore. And the afflicted person often experience a loss of motivation and interest on those activities. So we can conclude that depression is a thief of joy. And depression also can either be short or long term. Next. Okay, this is my research. How many people get depression per year? Depression affecting more than 8%, which is 21 millions of American adults. Also, 15% of youth, which is 3.7 million, ages around 12 to 17, are affected by depression. This is why depression is really important to you guys aware of it. This is the statistic of depression, or the reason or the factor why people having the depression. From the statistic, we can see that the most is studies and academic performance. So if you guys notice that you guys struggle with the academic, you guys shouldn't sit still, but you guys should have to wake up and ask for anyone help, like counseling or friends. And the second one is relationship. So whoever having a relationship, I didn't say you guys have to break up, but just don't be too hard on that relationship so that you didn't disappointed. And the others is family, financial matter, personal health, campus life adjustment, and other matters. Next. Okay, moving on. Causes of depression. We have to be aware of the causes of depression so that we can prevent them. Next. The first one is biological factor. Genetic. A family history of depression increase the likelihood of developing the disorder, suggesting a hereditary link. This means if your parents or grandparents already suffer from depression, the likelihood of you developing the disorder is increased. And the second one is brain chemistry. Imbalance in neurotransmitter like serotonin, dopamine, and norepinephrine can affect mood regulation and contribute to depression. If you guys learn biology, you will remember that serotonin help with mood regulation, and dopamine help with your focus or concentration, and norepinephrine, or it's called noradrenaline, help with your heartbeat. So if you guys have imbalanced serotonin, it means that you will have unstable emotion, and with the unstable emotion, that can develop the depression. Hormonal change. Fluctuation in hormones such as those occurring during pregnancy, postpartum, menopause, or thyroid problem also can trigger depression. Fluctuation means increases and decreases of the hormones. This is specifically for women, so just be aware of your health. Okay, moving on. Psychological factor. Personality trait. Individual with low self-esteem, which means low self-confidence, a tendency toward pessimism or high level of stress, may be more prone to depression. Pessimism means that the person tend to think negative things will happen to them instead of the positive. And trauma or abuse. Experiences of emotional, physical, or sexual abuse, especially in childhood, increase the risk of depression later in life. The last one for the psychological factor is chronic disease. Prolonged exposure to stress, whether due to work, relationship, or financial struggle, can contribute to depression. Next. Environmental factors. The first one is social isolation. Lack of support from family or friends, or feeling isolated can exacerbate feeling of sadness or hopelessness. This means even you are introvert, you still need friends so that your stress doesn't get over to you. And the life event, significant life change such as the loss of a loved one, divorce, job loss, or major life transition can trigger depression. And the last one is substance abuse. Alcohol or drug abuse can both cause and worsen depression, as substance often disrupt brain chemistry. This is why we cannot take smoking. We cannot smoking because it will lead us to depression. Medical condition. Chronic illness, long-term health conditions such as diabetes, heart disease, chronic pain, or cancer can contribute to feelings of helplessness and depression. This means if you guys have cancer, absolutely cancer, the person will feel hopelessness because he or she will know that and she will die and cannot enjoy the life like before. Medication. Certain medication, including those for blood pressure, sleep, or hormonal issue, may have side effects that contribute to depression. This is why doctor is really important because doctor know what best medicine for us. Okay, so far, do you guys understand?
Yes.
Okay, we moving on to impact of depression. Depression can have a profound effect on various aspects of a person's life. First one is emotional impact. Persistent feelings of sadness, hopelessness, or emptiness. Persistent is like you always feel sad and hopelessness or emptiness. Persistent is mean always. You continuously feel. And loss of interest in activities once enjoyed, including hobbies, work, and socializing. That's why I say that depression is thief of joy. And the last one is feelings of worthlessness or guilt. Cognitive impact. Cognitive impact, depression can contribute to difficulty concentrating and making decisions or remembering things. This associate with the dopamine that I said just now because dopamine help us to concentrating. Negative or distorted thinking pattern, often leading to excessive self-criticism or pessimism. Is thought of death or suicide in several cases. This is why depression is really important to us to know because in several cases they have suicide. They take suicide as the solution of the problem. Next. Physical health. Change in appetite which can lead to weight gain or lose. This is not good for us because the loss here are drastic and the loss mean that you lack of nutrient and that is really dangerous for us. It may cause fatigue or anything else. Sleep disturbance such as insomnia or excessive sleeping. This is also not good for health. Fatigue even after adequate rest, making daily tasks feel overwhelming. Social relationship. Withdrawal from social interaction leading to isolation. It can be related to the low self-esteem because when you feel like you are a loser or anything, you're afraid to socialize with people because you think you're not worth it for people friend with you. Strained relationship due to mood swings, irritability or lack of communication. Irritability means that you are easy to get mad on simple things like bad temper. And difficulty maintaining work or school responsibilities which may lead to loss or academic failure. Work and productivity. Reduce motivation and energy, making it hard to complete tasks or maintain productivity. It also can increase absenteeism or presenteeism. Absenteeism or presenteeism is mean that you are physically here but not mentally. Like you are here right now, but your mind still out there. Okay, and difficulty coping with stress leading to burnout. This is why coping mechanism is really important because it's one of the way to prevent us from getting depression. Okay, the last one for impact of depression, overall quality of life. Depression can reduce enjoyment in life and an inability to find pleasure in daily activities. It also causes long-term, which is untreated depression can increase the risk of other mental health disorder such as anxiety or substance abuse. In several cases can lead to disability as individuals may find it difficult to carry out basic daily functions. So far, do you guys understand?
Yes.
Okay, this is the important one. Ways to recovery. Always remember that every problem comes with solution. Okay, first one is seek professional help. We can start with talking to a mental health professional such as psychiatric professional. It can give us valuable guidance and best way to recover from the depression. In several cases, antidepressant medication prescribed by a psychiatrist also can help us to recover from the depression. So it's the best to know to ask the professional what is the best option for you to overcome the depression. Okay, connect with supportive people. Talk to trusted friend or family member. By your talking, actually it can help you ease the burden that you have and the depression, automatically we can prevent it. Support group. Consider joining a support group. You can join the support group either in online or physically, but make sure you trust the friend before you share about yourself. And the last one, challenge negative thought. Depression often brings negative self-talk. So if you notice that, immediately, um, try to overcome the negative thought and try to reframe it to the positive line. And journaling, writing down your thoughts can help you process emotion and identify negative content. So for the conclusion, depression is really dangerous and it should be exposed to us so that we can prevent ourselves from getting the depression. Also, parents should know about depression so that they can help or they can advise their children about the depression. So that's all from me. Do you guys have any question?
I have two questions. First, what you do when you at your lowest? The second question is what makes people afraid to express their feelings?
Okay, thank you for the question, Miss Sir. Thank you, Iskandar. Okay, for the first question, what I'm doing at my lowest. Okay. At our, not just me, at our lowest, we should get back on track, which means we have to find we have to find our creation. Creator. Oh, I'm sorry. We have to find our creator because it because Allah know everything, the best for us. And the second question is, can you repeat the second question?
What makes people
Oh,
afraid?
okay, thank you. Okay, we just human. We doesn't have power like telepathy that we can know what people think. That's why people are afraid to tell others about how they feel because maybe the people can judge them. That's why people doesn't really like to share their emotion to people, other people.
Thank you.
Yes.
As you have said before, smoking can lead to depression. So, do you think vaping also leads to depression as well? Why?
Thank you for the question, Hazika. Okay, vaping and smoking. What is the difference of them? Actually, it's quite similar because both um, both have smoke and have a really dangerous substance on them. So vape is also can cause the brain chemistry imbalance. Is that answer your question?
Yeah. I have a question. Sorry if my question sounds personal. Have you been through depression and how do you survive?
Okay, thank you for the question, Ika. Okay, actually, I doesn't experience the depression, but I have my friends at high school. She suffer from depression when around trial SPM, and what she do is she take break from school, from boarding school for 1 month. She homeschooling for 1 month when SPM trial is near. So I think that's some kind of way because I asked her why she feeling depressed, and she said that she really depressed about the studies. She really depressed about studies, even though she is really top student. Okay, that's all.
Any more questions? No. So I would like to touch a bit on your point on finding the creator just now. So So basically, you agree with what many people say that you are depressed if you don't pray or you don't seek God's help. So do you agree that if someone has mental health issues, it might be because they also have faith issues?
Thank you for that question, Miss. But I don't think that the reason is we doesn't pray, because the factor of the depression can come a lot of ways. Not just doesn't pray, you will get depression. No, not like that. Because no, not because. It just no. The answer is no.
Right, thank you very much.